Okay. We'll take silent as no. Okay. So we're gonna talk about the specification and um, the specifications and the EDR specific the edit checks. Before I start, just wanted to check: are there any questions or from the last session? Any questions? Okay. So I'll take it as no. So let me share my screen. I'll have to close. Otherwise, are you all preparing the? I mean, whatever I say, like last time I've asked you people, like I said, GCP principles and other definitions. Are you all able to go through it? Any questions from that? No. Okay. I don't need to ask, but still I'm asking because it helps you, not me. That is the reason I know I want you all to. Okay. How about others? For me, I can just simply I can just complete my session and go. But like I don't feel good. Uh, I don't know whether you all understanding or not. Okay, good. So this is the edit check specifications. The edit check specifications are nothing but in order to ensure that whatever the data that we are entering and whatever the information that we are entering and is correctly taken by the system or not. So let's say example, you have a mobile and you entered you entered the password, and when you enter the password, like it's not taking because you entered it incorrectly. Last time also I mentioned. So now when this enters, and what happens here, the the system is already saved your password, and now the system don't allow when you enter, either it is the wrong number, either it is the wrong type. When I say type, that means instead of entering the number, you entered the alphabets, or wrong length. Like let's say password is four digits, but you entered 5 digits. Okay, you entered 3 digits only, right? And the type, the length, and other parameters, right? So that's so whenever we see that certain data parameters, it's important for us to ensure that whatever we are entering, it's correct or not, whether the information that we entered is valid or not. And so now, how do we do that? How do we like when I enter the wrong password, like how it is even taking? So before it is even released to the end users, what these programming people does is that they write the specification. They write the what do we need? Like for example, let's take an example of mm, like I'm just thinking. Okay, like let's say you went to a tailor, like for the stitching of some shirt. So when you when you went there, and when you went when you went there, and you will tell him, like for example, okay, I want long sleeves, and I want short sleeves, and the length of the shirt should be this much, and it should have a I mean, one left pocket, and also that um, um, it should be in the so and so pattern. You see, right? That's called the specification, right? Or let's say one more. Let's take an example of let's take one more example. Like let's say you want to buy some mobile, and so you have the specifications. Um, you want to have three cameras, and and you want to have the length of the mobile, and it should have a Android or the something like the design, and it should have a 36 RAM or 32 RAM, and a lot of things happens because because that's how you wanted it. So even when I say specification, the requirements that we need for the particular system, I hope you all understand. I'm just trying to be slow as much as I can, but don't worry, you don't have to worry much about it. Why? Because you will not write the specifications, but you will not write the specifications, but the programming team does. However, you're supposed to check the you're supposed to check the particular the systems, and the systems in the sense of like whether the specification is correct or not, and whether the specification is according to my requirement or not. That's how it is. Now let's come to the live examples, like live example in the sense of, well, let's come to the some of the examples that we need or we can have. So here one of the example is for the systolic and diastolic. So this is one of the common edit checks that we use. This on a testing purpose. It's not the real data, but as I mentioned that there are three environments. One is the testing environment, and the U8 environment, and the production environment. So during the testing environment, we write the logics. Okay, if 1 plus 1 equal to 2. But what happens if my value became 3, or what happens if it is only 1? What? So that means whenever it's a wrong, like let's say 1 plus 1 equal to 3, that means the system issue. Or whenever 1 plus 1 equal to 1, if it is that, in that case, it's a system issue. So, but if there is a system issue, will that throwing me a query? Or will it give me a question to the person who entered the data? Hey, this is wrong, man. What you entered is wrong. That's what the edit specifications. The edit specification explains all that how the data should be, and it's also reduce the errors. It reduces the errors. So more, like for example, let's say that you entered 1 plus 1 equal to 3. That's fine. It has taken the form has taken what you entered, but but that's wrong, right? So what, imagine if it generates a query, and I would have not missed that particular incorrect information, right? And that's what it is about. So now the here let's talking about one example that the vital systolic or the systolic blood pressure, and diastolic blood pressure. So here the form is different and the field is different. The form is nothing but the all issue the form which contains the multiple fields, the fields that already that contains multiple data points. I mean, sorry, the form that contains the multiple data points. So now when you enter the data, and you enter the data, and so now let's take an example. So here the forms are visit 1, visit 2, and the other parameters. Now, what is the logic that we are utilizing here? What is the logics that we want to enter here? Is that if systolic blood pressure is missing, if systolic blood pressure is missing, then open a query on systolic blood pressure. That means when you don't enter the data on that particular field, there should be a query. What should be that query message? Systolic blood pressure is missing. Please enter or else clarify why you are not entering the data. Simple. But the question is now here, you might think, what if I don't have a data? Or what if I don't want to enter the data? No. As per the protocol, you are supposed to perform the diastolic blood pressures for the particular patient. And let's say that you missed it by mistakenly, you did not do it. So when you don't do it, what happens? You can't enter. So but still you're supposed to clarify it, right? And you're supposed to clarify it. States that why you do not have the particular information. And also that whenever like for example um like let's take an example of missing data or the incorrect data. So what how the incorrect data will be? um like let's say you entered 3 digits instead of 2 digits. So in that cases it will generate a query. Why? Because it will generate a query stating that you entered the wrong digits, enter the wrong disease. So whenever we don't enter any of the data, or whenever we enter the incorrect information or incorrect type, it generates the query. That is the reason behind the edit check specification. What you do, you I know sometimes you just listen the session, but I want you all to take this note. Just put a box, edit check name, form name, logic test, query message, and action and the type of query, check type. I'll explain you. This take till action words. Five, just this one line, not everything, only the systolic diastolic one. Take this 5 fields. Done guys? Okay. So the same goes into the other parameters. Okay. Okay. So if you look into this parameters here, um, this is for the diastolic. So now what happens? What is the action that you want from this test case? What are you trying to say by having this specification? This is your requirement. And what happens if I don't meet? Okay, for example, let's say that um, when you um, just trying to okay. Just trying to see an example. Okay, let's say that you gave me a money of 500 rupees, and so I'm supposed to give you 100 back, but I did not, and you did not ask me a question. You just went off. That's unusual. That's something is incorrect, or something is not right. That you either you forgot, or you didn't know that you would get change back. So what happens if you keep doing that? If you keep giving me every day 500 and stuff without taking 100, you will lose a lot of money by the end of the month. Same way, imagine that I'm supposed to enter the systolic and diastolic data, but I'm not entering. because I missed to collect from the patient, or patient has given all these vital signs, but I'm not entering. What happens at the end of the clinical trial when I'm trying to analyze the all the patient vital signs, like how the patient is doing in a clinic, how the patient is doing in clinical trial with all his vital signs, like is he stable or not? So how can we say, how can we find out whether he's stable or not? Through patient vital signs only. Now I'm missing systolic, but imagine whenever I miss that point to enter, and without entering that point I came to the next point, and if it generated a query, I would have not missed it, right? That's simple. But I, even sometimes when you are entering something in the mobile, there is always a question, I mean star mark for the important things. That means it's important. Without entering that, you will not able to go to the next page. That's what the star mark, same that. So who will update such a star marks? Even the edit check team. Edit check team updates all this kind of information. Okay. And then, so what is the action that you need? So we want the query to be generated. We need a action of the query. Then the type of query, the system generated query. System generated query. And whenever the system generated a query, and what is the check type? The missing data check. So one thing. Now the second, so I want you all to write the the third one, whatever highlighted. This is for the different, this is for the check type is the range check. So now what we're going to do, we're going to look for the missing data one, and we're gonna check for the range check, we're gonna check for value, and we're gonna check for the cross module. Okay, so write the third one for every example, because I know that later you'll not check, I mean you'll not take some. Okay, so now what we are looking here is that the range check one. So here, if your temperature is entered less than 37 or the more than 42, so ideally it's a in um, it's abnormal. Okay, let's say that patient um, the health the temperature is less than 37. That means it's something is wrong. Something patient is like is the temperature is incorrect, and we are supposed to check, double check. Let's say actually the patient temperature is less than 37 only. That's a correct value. You enter and you can explain that yes, this is correct only. So when you say, or else let's say patient temperature is more than 45, like let's say 46, and you said there is a query, hey, this temperature is beyond the normal value and beyond the what we set for the specification. Can you explain why it is 42? What a nurse knows, like for example, she said, yeah, it's 42, that's 45, that's what the patient come with temperature. So that means it's a, like let's say fever. Now they'll go back to the adverse events form and check if the patient has more temperature, did they report as an adverse event as which is a fever or not, or something else or not. And that's what they're gonna correlate with. So here, if the temperature is entered, and if the temperature is entered, and then open a query on the body temperature for incorrect data. Data entries out of range and the please correct them generated the open query, system generated query, and the range check. That means it's a system generated query. Okay, why there are different types of queries? Why I'm saying the system generated query? What else will be there? Right? What else it can be? So it can be, there are other different types of queries also. There is a system query, and there is a CRA queries, and there is a um, 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 data, I mean, a medical data reviewer query, and also that there are other queries. So why these queries, or why there are different types of queries, we will explain in the query type in the coming sessions. Now, so let's next we're gonna check the missing value. So here the data demographics. So the demographics nothing but the patient age, gender, ethnicity. And if the date of birth is missing, then open a query on a date of birth. And date of birth is missing, please enter date of birth. Now, you not enter the data only, data itself. Here in the first one, the data is missing the file. Here, I mean, what is the difference between, here's the missing data check. Here the value is missing. So in one parameter, this is in the field. Whereas in the data demographic, whenever you, like for example, if data but the whole data is missing, here within the vital signs one data field is missing, but here entire data is missing of the data of birth. It is the missing value. So whenever we generate, whenever we see such issues, and we expect that there should be a query that has to be generated. Any questions here? Okay. Now I also wanted to tell you people that the UAT, the last time, I know we have gone through it, and so vitals. So whenever we have the whenever, like let's say that here the logic test is the, if systolic blood pressure is missing, then open a query on the systolic pressure, blood pressure for missing data. And and they generate the query, open query. And in that cases, what happens here, that the query message will be systolic blood pressure is missing, please enter else clarify. Now you might be confused for, so what you do, I'll just tell you. Okay, yeah. So first is the UAT. So what we do, we enter the types of example. Okay, sorry. Yeah. So this is the test that we wrote. So this is what we wanted. So action should be open query and everything. Now, when we do the UAT, we will test on the case. Like we will take in a case report form, and we will take a test form, and then we will enter some wrong information, incorrect information, or let's say we don't enter that all the data. So in that cases, we check whether we getting the data or not. right? Whether there is a query that is being generated or not. And that's what the UAT. So, so what is the CRF designing? It's a form is which is a digital, usually web-based, which is a questionnaire for collecting the data about a clinical study participant. Okay, so a case report form is designed to collect the patient's data in a clinical trial. And whenever it's a development represents the to collect the particular information that has been updated. Now, so what is the importance of the CRF, the designs that we do? So we do a lot of specifications, we do a lot of UAT. Um, what happens? Like, what does it even meaning, or what even um, talks about? So it aids the assessing that means it helps the assessing the safety and efficacy of the medicinal product. Because what happens is that in order to ensure the data is correct, in order to ensure the information is what we are entering in before even enter the data or before even the data that is being updated. Now, what happens here is that in order to say that the data is or in order to ensure that the drug is valid, I mean the effectiveness, and also that whether it is safety or not, the data is important. But when I don't have the data, that talks about to the data that is coming from the patients. As I've already mentioned, data is nothing but a valid point. I mean, any observations, any findings of the particular from the patient's information. So what are the points to be considered? Sorry. What is the points that are that consider when while we design in the case report form? One is that the repetitive data such as the protocol ID, site code, subject ID, patient initials can be considered. So what happens here is that for every case report form, we will have the protocol ID. So that means why? Because if you're especially if you're using the paper case report forms, the papers might change. That is the reason back in many years back when we were using the paper case report form. So on every case report form, you're supposed to enter the protocol ID and the site code and the subject and the patient initials. So which also needs to be considered. And also that the consistent format that what we enter, the style, the font size, everything should be according to the process actually. So because you can't have the multiple colors, multiple font sizes, multiple formats. So what is the, okay, take note of it, the process involved in the ECRF development. So these are the points that needs to be considered before we design the case report form. Take note of it. Because I have to tell you maximum people to write. I know I'll be sharing, but still I want you all to have the specific important points on the notes. Means the design of the particular study and the eligibility criteria and the registrations of the randomizations, like based on what you're gonna randomize the patient, and the treatment and the disease evaluation and the study calendar. um so this is not required. So I think I was showing you people. So this is how paper case report form looks like. Yeah. So this is how the Rave database looks like. And this is one of the images that we have collected from the electronic data capture. You're seeing right on the right side. This is the visits. So when you click on the visit, and it will show these forms on the left side. Okay. So that means within each visit there will be multiple forms. And when you click on the each form, again you will see the field. Do I have the fields? No, I'll show you the next images. I'll show you. So how the right, I'll tell you the process of. Okay, don't have to write. I'll explain you. So the first in the it is the visit, then form, then field. So for every subjects there will be visits. Okay, like whether it's one visit, two visits, three visits, and for each visit there will be multiple e forms. Okay, within the multiple e forms there will be multiple fields. Now let me example. Screening is the visit. Under the screening there will be many assessments like demographics, vital signs, and the tuberculosis test type of thing. So within the screening you have the forms of the demographics example. Under the demographics there will be many field like age, gender, ethnicity, race, date of birth, five field you're supposed to enter. When you enter these five fields, that means one form is missing. Sorry, one form is completing. So likewise, whenever you are entering the data, you're supposed to complete all the fields of the data. What happens if I don't enter? Or what happens if I miss? So if you miss, that means it's incorrect. It will generate a automatic query. You all got my point? Okay. So write a question, I'll tell you. What is EDC check? Sorry, what is EDC edit check? I don't know. Everyone is so kept quiet, and I don't know whether you all understanding or not, but I want you all to. I hope you all getting point. Okay, so what is the EDC edit check? Yeah, good. I'll tell you. Before I just go for next question, I've just one of my old student messaged me in LinkedIn. So this was when I was in Bangalore in 2021, I think. I went to their college to teach clinical data management 5 days. So it is a 30 hours. So daily six hours. I went there and I taught them completely 6 hours per day. So when I went to college, I was there for 5 days. So likewise, I went for 3 times, 15 days. So it was good, and sometimes she tried to that student tried to kept in connect with me. I was like, never. I'm not into much into this LinkedIn or anywhere. So today I saw she pinged me stating that, sir, I've got my placement in I mean a job in LinkedIn, and I was so I got job in what is that company um, Parexel. So Parexel, one of the CRO as a operational coordinator, where she managed the clinical trial operations and all. I was like, wow. And she said, "Sir, you inspired me a lot. And during when you came to our college and you spoke about these companies, and we got inspired. And as soon as I completed my Form D, I got this job within 6 months. I was working as a trainee and all. Then I got this job. I was like, man, such a great. I was so happy, not because she acknowledged my efforts, but she the took that inspiration. She wanted to do something. She took something out of that sessions. Like, okay, I want to get into the corporate, not as a corporate, but I want to get into the clinical research. I want to get into these companies, start my career. You see that now she don't have to look back her life again. She will have a very bright futures and all. There are a lot of people like that. So there was one of the other student being like, he completed his masters. He wants to go to abroad if he don't get the job, but he got the job in CDM. Today he becomes a clinical data specialist within 3 years, and so good. The I've referred him in my same company when I was in India. Like it's good. So I don't know what's happening at the end of the other end users like you people. Like at the end of the sessions, utilize the session, ask the doubt, at least put a message in the chat box. And whenever I'm trying to tell some stories like this kind of inspire stories and all, you take note of it. And okay, let's say that you complete this session tomorrow, you're free. So what you're going to do? You maximum will have 1 hour session in a day. So rest of the time, what you're going to do? Are you working on your resume? So let's say you completed your just B form, CM forms, or form D, whatever. What we will have in resume? Nothing you'll have. Just your education, nothing, this course, nothing will have. So how can you add more kind of certifications, more kind of knowledge that someone can call even for the interview? Next step later. First of all, someone should call me for an interview to prove that I am fit for this role. So how are you preparing yourself to do that? So if you don't take efforts now, what happens in future when you're slowly becoming unemployed? Like sometimes it's becoming hard to get the job in future. Then you'll have to settle for less, right? So that is the reason. Take some time whenever you have some free time, and prepare yourself for resumes and your knowledge, and that will help you for the future. Otherwise, what happens that you'll remain have to be very into the something you don't like. Okay, so any questions so far? Spandana Bamsa, you said Phoenix, you mean Arizona Phoenix, like the US? Okay, whatever. I just see, you can improve the, for example, last time I mentioned about GCP certificate. So you search in Google how to get the certificate, GCP certificate in online for free. There is a website, there are websites that he gives you the free. So that is one of the certifications. That is adding the skills only. So when you do the GCP certificate, they just don't give you the freely. So you'll have to write the test, online test. There will be 60 questions for 1 hour. So you'll have to go through all the GCP process, like, ICF, data privacy, and protocol, all the parameters. So when you study all this, you get a certificate. At the same time, you'll get the skills. At the same time, this course also. When you just don't get the certificate, you will get the additional skills. Like what is the ECRF? What is the data point? What is the database? What is the array? What is the SAE? What is the safety database? What is the data management database? So these are the skills. So that means you are earning the skills plus you are earning the certifications also. That's what I'm trying to do. So whenever you are doing this, like coming to this session, try to note all the points that I'm saying, and that will give you though, that will give, okay, one point. What is the database lock, for example? That one point, that one word has a huge definition, and that's one word only you'll get in the interview, and you'll have to elaborate in the interviews. That is a skill. Take a point, drag it, make it more understanding. Then you'll get benefit out of the session that I am saying. Because you might forget whatever I say, but the keywords no, and that's what I'm trying to say. Got my point, right? That's what I. So utilize these sessions. Whatever I'm saying, ask the doubts in between, and you will definitely get benefited out of it. But otherwise, no matter if I teach you for 100 of hours, there won't be any benefit. Okay. So that's all from my end, and catch you all in the next session. Thank you so much. Bye bye. A happy weekend.